And technology is taking a step forward, especially for the girlies who are expecting. Woo! I'm telling you now, the clinic is coming to our fingertips through Expect Pregnancy Care. Joining us to unpack this is Dr Qinisile Cele, who is an award-winning obstetrician gynecologist and founder of PreggyCheck. Let me tell you something. You are getting our ovaries tingling, Dr. Cele. Thank you so much for joining us on The Upside.
Thank you so much for having me. Lovely to be here. Thank you.
So what experience, because I feel like most of these innovations come from experience, right? What experience or what kind of prompted this type of innovation for the preggy girlies?
Yes. I would say that it is backed up or initiated by my own personal experience as a gynecologist, backing it up with 20 years. I'm celebrating 20 years as a medical doctor this year. So I'm a class of 2006. Yeah. And I've worked with women throughout all these decades. So it is multifaceted. The reason why PreggyCheck was initiated, and I always tell the story that it's a fun fact because it originates from a story of a couple, and there's many of them. I know most healthcare practitioners will relate. Patients who come in with a lot of anxiety, with a lot of questions. Others they forget. Others they'll be trying to remind each other what is it that they stay awake thinking about, worrying about at night. So there's this couple, lovely couple, supportive dad who used to travel a lot, and he would come into my office with a lot of anxiety, with numerous questions. Doc, when I was in the US, she called me and she said, this and this is happening. So what must I do when that happens? What must I tell her? What's the correct information? I checked Dr. Google and this and this and that. So there's a lot of confusion that's out there. So the fun fact of the initiation or the establishment of PreggyCheck was due to the connection that I wanted it to bring, the information, and keeping family members updated, not just the partner, because, it might be one person who's carrying the pregnancy, but the whole family is pregnant. The granny is pregnant, the brother, the sister is pregnant, the husband is pregnant. So it is to keep them informed that when you get your blood pressure checked and the light turns green on your application that says, your blood pressure is normal. Your husband, wherever he is, your mom in another province is able to see, if you'd like to share that information with them, that the pregnancy is going green, everything is good. And the true reality over the past years is something that all medical practitioners know and everybody involved in health is concerned about, which is now the fact, not just the fun part of connectivity and being updated. It's a fact that we have a lot of women that are still dying, numerous women that are still dying due to pregnancy. They die during pregnancy, they die during giving birth, or they die within the first 6 weeks after delivery. Be it from a miscarriage, an abortion, or a pregnancy gone bad. Scary statistics is that more than 250,000 of women globally lose their lives from pregnancy. So we cannot keep quiet. It's one of the sustainable developmental goals to improve maternal health, to improve the health of women and their babies, because also not just women die, but their babies also demise during the process of pregnancy or giving birth or soon after in early infancy. So the numbers are huge. They are screaming. And the saddest part being, me being in Channel Africa, which is very relevant, is that about 92% of these deaths, I said about 260,000 women die globally. Now, about 92% of these deaths is from low to low middle income countries.
Sure.
And that's us, that's Africa.
Sure.
About 70% of these deaths are in Africa, originate in Africa, and about 17% is in South Asia. So this is sub-Saharan Africa, 70%, and South Asia is about 17%. So those are huge numbers. So this is talking to our aunts, our moms, our sisters, you know, that are losing their lives during the course of pregnancy. So obviously, with the advancements of technology, why not use that to improve the quality of life, to prolong or save another life, or actually, it's two lives in one with pregnancy.
Dr. Q, chat to us about the technology and what it actually offers. I know that you've got expert medical guidance as well as practical tools. What are those and how are those going to help, like you mentioned, the people in the poorer areas on the continent?
Okay, so number one, if you would check at what causes women to die from pregnancy, it's what we would call, most of the time, it's what we would call patient-related factors. Not that the doctor did this or the nurse did that. First and foremost, it's patient-related factors. What could the patient have done differently? So, as we all know, people die due to lack of knowledge. So PreggyCheck starts by bringing awareness, education, telling women what are these danger signs that they need to look out for. What is it that says this is a red flag in pregnancy? Run. Don't sit with it. Don't sleep. Don't say you'll see it tomorrow. See your healthcare practitioner now if you see this during pregnancy. So that is what, number one, first and foremost, PreggyCheck does. It educates. It brings about awareness. And then again, in this awareness, PreggyCheck then goes on to translate or interpret or explain these medical terminologies and figures and vital signs that patients mostly leave for the doctors. My blood pressure, the doctor checked. So what did it say? I don't know. Whose blood pressure is it? Mine. But I don't even know what it means. Does it mean I'm okay? Does it mean I should worry? Is there something else? What happens if a doctor mistakenly focuses on maybe your swollen feet and does not check that blood pressure? Are you even aware that you needed to get your blood pressure done? When you get to a nurse's office, you need to get your urine tested. Don't leave without having your urine tested in pregnancy. You need to get all these things. So that is what PreggyCheck does. It makes women aware, educates them of what is vital in pregnancy. And they are not called vital signs for nothing. You know, vital comes from a Latin word, actually, which is vita. It means life. So this is your life. And then, as we always say in pregnancy, it's the lives of two in one. So that is what PreggyCheck does. It interprets those things. It also helps with continuity of care, because when this blood pressure is checked, you can check it at home. It promotes women or encourages women to attend antenatal visits, to get that checkup, to know that at this gestation or this stage of pregnancy, you need to go and get a checkup. These are the questions you need to discuss with your healthcare practitioner. Discuss about your relationship. Are there signs of GBV? Are there support system? All those things are important. When to vaccinate, what to vaccinate for. And then it also keeps all your blood results in one place. It keeps those notes that are fragmented everywhere, all the medical information that we keep in different handbags, and we lose the sick notes and we lose the prescription. All of those things are kept in one record, because again, this is your life. It's that critical and that important. And when you change healthcare practitioners, you have all this information at the tip of your head.
Oh, this is beautiful. Dr. Q, we're going to continue the conversation. We just have to go to sport and econ news. But what an incredible technology that she's developed. Dr. Qinisile Cele chatting to us now about the app that she founded, PreggyCheck. Absolutely awesome stuff. It's 4:30. Let's check in with the sport. Here is Saikon. We are still in conversation with Dr. Qinisile Cele, who's an award-winning obstetrician, gynecologist, and founder of PreggyCheck, which is a technology reshaping healthcare for pregnant women and their families. Doctor, welcome back.
Thank you for having me again.
Magdalena, let's talk about the women who are choosing to do pregnancy on their own. For whatever reason, they've decided that, maybe they want to go the sperm donor route. They want to kind of just rock this as a single mom. Some are under circumstance, but I want those who are kind of building their village outside of maybe a partner. How can an innovation like this support those type of women?
Okay, that's actually a very valid question because we have that on the rise now with the issues of infertility. I'm also a reproductive medicine specialist, so this is what I encounter quite frequently, where women also leave baby making to later stages where they've climbed the corporate ladder. And then you find that by the time they are ready, all other circumstances are not putting it together. So yes, they go solo, and we then find ourselves having to assist them with the pregnancy. And, an application like this has different sections, and that's what is amazing about PreggyCheck, because there is specifically what we call a Preggy section or a Preggy corner, where it speaks about all the medical factors that you need to be concerned about and watch out for during pregnancy. And then it has a mom's corner. Now, the mom's corner deals with you, and it deals with your emotions. It deals with your spiritual upliftment. It deals with mental health as well. And certain sections in a PreggyCheck also, you find that once you've subscribed, once you've downloaded the application, we do a mental health check on a weekly basis.
Wow.
As your pregnancy grows,
Wow.
there is a notification specifically on mental health. And, one of the hard facts is that one of the rising maternal mortality factors or causes as well is suicide.
What?
And it was not something that we had like 15 years ago, for example. It was not even featuring as, the top of the list of maternal mortality, or the death of pregnant moms. But this is found more related to higher income countries, which is very strange. And those are the type of women who can afford a sperm donor, a type of women who can afford intrauterine insemination or to go through IVF on their own, the higher income. So then you find that this now suicide is actually on the rise. So we do have a mental health check, and we have questionnaires as well as during the course of pregnancy, where we attend to mental health. And a section that we're also developing as we speak, because we're advancing and new features and updates are coming up, is a section, especially also post-delivery, postpartum, where a support system is critical, where back in our home, where the mother-in-law will come in, or your sister, or whoever will come soon after delivery to assist you with the young baby and you and your recovery as well. So this is also a very critical point, where now we also are able to check on your mood. Your mood is very important. Is it low? Are you getting better? Are you happy? Are you feeling used? There are women who suffer from postpartum depression and psychosis and all of that. So those are the things that we have questionnaires and traffic lights, where when you answer a question, then it turns green, it turns orange to say, watch out about this. And then it turns red to say, please do get a checkup.
Wow.
Don't sit on this.
Dr. Q, you are currently in Dubai as you chat to us this afternoon on The Upside. Maybe chat to us about, the innovations that you're seeing in the industry that you're in Dubai, and how those are helping you further develop your app. Because I imagine that what's happening in Dubai is different to what's happening on the African continent. But how are you kind of taking the knowledge that you do have and pairing it with what's happening there?
Oh, yes, because where I am, it's quite an advanced and developed country where innovation is rife. So everything here is accessible, and that's what we are struggling with currently in Africa, access to healthcare. Even transportation is an issue where it's not a problem here. Simple things like having highly qualified personnel is not available in Africa. And you need women to have the information at the tip of their fingers for them to know that this is now dangerous, because there won't be someone close by monitoring them to say that, okay, now, we need to take caution. So women need to support themselves by having this information at hand. So here, everything is accessible. We don't run out of data. You hardly hear someone talking about airtime, data. It's not a topic almost everybody has.
I love
So we've got medical centers, and the actual government itself has something close to what PreggyCheck is. It's just that, it does not go on to interpret and explain and educate, but they have continuity of care where you can go to any medical center in the country and your information is accessible. The last blood test that you did in another hospital will be available when you go to another medical practitioner. So that brings about urgency in care, where emergencies could be picked up. A certain caution or problem that started a week or 2 months ago can be picked up by another practitioner when you come in times of emergency, because there is that continuity of care. The records are kept. We don't have a story of the file is lost, which is what we commonly find back home in Africa. Then you're seeing a patient, you want a history, there's no file. It's like you're seeing the person is coming into the medical fraternity for the very first time. You need to start from scratch and collect information. If you don't know the patient's file number, it's difficult to check them on the health system. And the patient will be like, I was here last week. And then we'll be like, it's in archives, it's in admin, the file is somewhere in the hospital. But if she says, I was here last week and the doctor did something, okay, here's my blood results. This is my blood pressure. And she opens and she shows us her vital signs. And she says, oh, okay, no, my blood results, if you can't find my file, I've got it. I've got you. I've got me.
Wow.
Here's my blood results.
Dr. Q,
this is what was going on.
Chat to us about where we can download your app. We really want to support and be part of this journey.
Okay, so the app is available for Android users. It's available on Play Store, Google Play Store, and you can download from there. And also for Apple users on Play Store, it is downloadable. And if you just want a quick link, you can go to our website, PreggyCheck.com, and you can also just download from there and subscribe to our membership as well.
Fantastic stuff. Thank you so much for joining us on The Upside right here on Channel Africa. That was Dr Qinisile Cele, who's an award-winning obstetrician, gynecologist, and the founder of PreggyCheck.